is. So, NSER Socioeconomic Registry is an all-encompassing data set to provide a full spectrum of household-based status of poverty and well-being across the country. NSER has been evolved over the years as the most reliable data set used by a variety of stakeholders, including public sector institutions, policy think tanks, and development agencies for designing social protection and poverty alleviation programs and interventions. We carried out this exercise for the first time in 2010-11, as we mentioned in our video, that when we conducted this exercise for the first time, it was purely a paper-based exercise. So we collected the information of around 27 million households at that time. We started the update of this database because we were receiving this criticism that the information we collected in 2010-11 is static and we are not updating this information, and those who are part of receiving the benefits, they are continuing receiving benefits, and those who are out of the program, they are not getting the opportunity to become part of the program. So we started consultation with different technical people, stakeholders, to work on updating this registry. We consulted with all provincial departments, we consulted with technical leads, we consulted with economists, and we basically tried to develop a model which will not only enable us to update this registry, but also give us an opportunity to make it dynamic. So when we designed this NSER update, we designed with a passion and with the point of view that we will make this registry as a dynamic registry. So this NSER update was started with a pilot in 14 districts back in 2017, but the major rollout was initiated in 2019. So as of today, we have now completed the NSER update all across the country, and we covered 100% household in the country. Through this update, we collected accurate socioeconomic data of 100% of the household in all districts using the socioeconomic updated poverty scorecard questionnaire. Household profiling performed on the basis of socioeconomic characteristics. Update has reduced the error, both inclusion and exclusions in the repository. Today we have a data of 34 million households in our database. And this will serve to identify the poor household for potential assistance to various initiatives of SARS, not only through SARS, but all other initiatives in the social protection, whether at a federal level or at the provincial level. Next. So the coverage, we covered all 160 districts across Pakistan, and we divided the country into 8 clusters for carrying out this survey activity. So we set a benchmark to set a target to cover each and every household as we take 2017 census caseload. And the benchmark was to cover 33.1 million households on the basis of 2017 survey. Since there were 3 years we spent on completing this activity, there was population growth during that time. When we completed this activity, we were able to cover 34.4 million households all across the country. We used 43 indicators, including demographics, geographics, health, education, socioeconomics, and assets. We used proxy mean test approach, which is most reliable for targeting the poorest of the poor, and we use CAPI-based repository of Pakistan with minimum error. So with the help of CAPI-based approach, we try to reduce the error rate that we actually observed during our 2010-11 survey activity when we carried out this survey through paper-based approach. So to just let you know how we divided a whole country into 8 clusters, as Madam Chairperson explained, the innovation we brought in during our survey activities. So we changed the model. We started with an NGO-based approach, but we during the implementation changed the design, and we actually involved other institutions, and we institutionalized this activity. We seek help from the education department from the different provinces to complete this survey activity. So we divided the whole countries into 8 clusters. In AJK, GB and KP, we carried out this activity through teachers following the census approach. So we trained all the teachers, we procured the tablets, and with the help of the teachers, we completed the survey in AJK, GB, and KP. And in some part of Punjab, we also, like in 4 or 5 districts, since it was, as I mentioned, a digital survey, we are collecting the GPS coordinates of each and every household. So there were areas where there was a security concern. So in those areas, we also use teachers, areas especially with the bordering districts with other countries. In Punjab, we used NGO for collecting this survey activity. In Sindh and Balochistan, we again use the services of NGOs to complete the survey activity. In some parts of Balochistan and Sindh, we also use the services of NADRA to carry out the desk-based survey to complete this activity. So this was how we actually divided the whole country into 8 clusters. So we use mixed approach. We use NADRA for areas where we observed some gap in door-to-door activity survey. So we completed the coverage with the help of NADRA. So we used teachers, and we also used the NGOs hired through a competitive process for completing the survey activity. Next. So how the survey is carried out. So we, as I mentioned, we covered each and every household. So we knocked each and every door of the country using the captive approach, and we used 43 variables to complete this activity. The survey was asset and consumption based data approach, and on the basis of data we collected from the field, we calculated the score of each and every household of the country and rated between 0 to 100. So 0 means poorest of the poor and 100 means well off. In order to ensure the survey quality, we used different approaches, like we hired third party for spot check and process evaluation. The third party remained in the field on continuous basis, shadowing the survey teams and sending us the reports on the quality of this survey exercise. We also set up here the control room through which we actually monitor the each and every numerator. We monitor each and every NGO, the teacher that we involved for the carrying out the survey activity, and giving continuous feedback to the field for improving the coverage. So we were here managing all the field teams by sitting in the control rooms. And at the end of the survey exercise, we conducted the data validation with the help of NADRA. So all the CNSEs received from the field through this survey exercise were validated from NADRA database, and there were certain elements like age, gender, marital status, name, all were validated from NADRA database. Next. On the completion of the survey exercise, let me share with you the process of the beneficiary identification. So when we say the beneficiary identification, we are talking about the beneficiary of our program. So following the same process, all other social protection programs, whether at a federal level or provincial level, can use this database to identify potential beneficiaries for their programs. So the first process was the data collection. Then we, in the second step, we calculated the PMT score of each and every household. Then NADRA was involved for the data verifications. We used the exclusion filters to ensure that the beneficiary we are identifying is actually poor. So these exclusion filters were used to overcome the expected misreporting that happened during these kind of survey exercise. So if someone reported wrongly in the field during the field questionnaire survey, so we can exclude that particular family with the help of these filters, which we actually link with other institutions, and we are strengthening these exclusion filters in the future as well, and linking our database with other institutions as well. So all those passing through these exclusion filters are declared as beneficiary to receive all the benefits under the SAS program. Next. So let me now share with you the important indicators that are available with us that we collected during the field, and the purpose of sharing these indicators is to give opportunity to all the institutions sitting here working on these indicators to actually avail this data instead of carrying out their own activities and or exercise. They can avail this data set for the purpose of planning and for the purpose of executing their programs. So to start with, our first section of the questionnaire was about geographic data. So we collected information on temporary and permanent address of each and every household, contact numbers, GPS coordinates, province, district, tehsil, block and enumeration area. So now with the help of this GPS coordinate, our database can tell that, God forbid, if there is any shock happened or there is flood or earthquake. So our database can tell that what kind of households with what kind of welfare status residing in the affected area. So for the planning purpose, God forbid, if some area is affected by flood, we can tell that from 0 to 100, which kind of household residing in the affected area. Then we also collected the information on demographics of the households. So we collected information of each and every member of the household, total members of the households. We done the gender profiling, a number of children they have. So we collected the information of all the children, name and the bare form. Then we carried out the age profiling, and we also collected the CNSE and the bare form of the population whose CNSEs and bare form were available at that time. Then we also collected information on education. So education status, literacy status of each and every member of the household. We also collected information on literate population, out of school children information is available with us. We also have the information of children never gone to school. We also have gender bifurcation of children and with their education status. And we also collect information of reasons of being out of school. On the health side, we collected information on the chronic disease. So we have the information of priority diseases available with us. We also collected information on infant mortality and stillbirth. We also collected information on differently abled persons. So all types of differently abled persons data available with us. So we collected information on upper limb, lower limb, mental, hearing, visual, so all type of disability data is available in our database. On employment status, we also collect information on employment, not employed but seeking work, retired, status and nature of the employment, whether they are daily wage, labor force, agree and non-agree, on job, if they are on job, whether they are serving public or private sector, on businesses, working hours and days, and labor force participation. On energy consumption, we collected information on availability of electricity, solar, UPS, generator, availability of gas, type of fuel used in household, whether it's fuel, wood, or other source of fuel they are using. Then we also collected information on appliances profiling being run on electricity. Then on household assets, we collected information on basic assets that that particular household has, like heater, washing machine, geyser, AC, fan, cooking range, television, refrigerator, sewing machine, a laptop, motorcycle, tractor, or a car, etc. On the structure profiling, we collected information on a dwelling and non-dwelling structure, type of structure such as houses, offices, health facilities, shops, hostels, hotels, and construction types and materials of that particular household. On communications, we collect information on internet availability, laptop computers and mobile phone. On agriculture land holding, we collect information on agriculture land availability, land units, area, cultivated land availability, and cultivated land units and area. On WASH, we have information available with us on formal and informal toilet availability, flush connected to public sewerage or pit or open drain, dry raised latrine, the rate of open defecation, and we also have information on source of drinking water that particular household has. We also have information on the livestock, so small and large livestock profiling, and what kind of livestock they have available in the households. So we used all these indicators to actually determine the socioeconomic status of the household and rated all the household, as I mentioned earlier, between 0 to 100. And not only we rated all the households from 0 to 100, we also classified these households into 5 socioeconomic statuses. You must be familiar with income quantiles, so following the same approach, we divided all the households into 5 socioeconomic statuses, which help the different programs to design their program. Like if someone intend to give benefits to only first quantile, we can identify that which household is falling under the first quantile, second, third, fourth, or fifth. So all type of socioeconomic statuses available with us, and with the help of PMT score, we can classify these households into different socioeconomic statuses. So this is one of the examples that we have information on households. I already explained that. Next. So at the end, I'm going to present the household coverage that we had province-wise. So we completed, and again, as I mentioned earlier, the benchmark was 2017 census number of households. So when we say the percentage of coverage, which is above 104%, we actually using the same benchmark of 33.1 million, 33.04 million households that is available from the census 2017. But we actually overshoot this data collection. So we completed 117% in AJK, 126% in Balochistan, 116% in GB, 100%, almost 100% in ICT, 125% in KP, 91.5% in Punjab, and 112% in Sindh. So overall coverage is 104%. So now we, as I mentioned, that we designed this survey with a vision to make this survey a dynamic survey. We collected this information 2011 for the first time, and we were unable to, despite of all efforts, we were unable to repeat this exercise after 5 years. So ideally, this kind of activity should have been repeated after every 5 years, if we are going for this door-to-door survey. But the kind of situations we have, the hazards, security, all those things, it is very difficult. It's one of the lessons learned that we have. It's very difficult to carry out door-to-door activity every time. And you can take the example of census. The census was carried out in 1998, and then it was collected in 2016. So it took almost 18 years to repeat the census. So similar kind of experience we also faced during our door-to-door activity. So having that lesson learned in mind, we designed our registry in a way that it should be dynamic, and we should update certain information on a real-time basis. giving the opportunity to the poor households to become part of the program if they were not during the first leg of door-to-door activity. So I will quickly present you that how we are making this registry a dynamic registry. So the static registry, the challenges of static registry is that carrying door-to-door activity for data collection has required a lot of efforts and resources. It took us 2 years to complete the first time in 2011 and 3 years in NSER update in 2021. So static registry does not cater the inclusion and exclusion error, and neither it's a shock responsive. Static registry does not take in changes in the socioeconomic status of the households until the registry is updated through door-to-door activity. When we completed this activity for the first time, we spent around 6 to 8 billion, and this time we spent around 10 to 12 billion. So every time spending 10 to 12 billion rupees is something is very cost expensive. So now we are transiting from static to dynamic registry to make it more targeting efficient to avoid possible inclusion and exclusion errors occur due to continuous change in the socioeconomic status of the household, especially due to the demographic change in the household. So we prepared this following 6 steps that we are adopting to make our registry a dynamic registry. So as Madam Chairperson indicated that as we speak, we are already in the process of, we already made our registry as a dynamic registry. So our first point is door-to-door activity, which we have already completed. This type 1 is the update of missed information. So we established desks all across the country. We have established more than 550 desks all across the country at the C level to cover the missed out households, to collect the missing CNICs during the door-to-door activity, the discrepancy resolution that occurred during the data collection, update CNICs of all adult members. Then we are also ensuring to collect the pay form of all the children, and we're also giving the volunteer opt-out option for those households who are part of our NSER program. If they consider that they are not eligible for receiving these benefits, they can always come and opt out from the program. In the type 2, which is currently in the process of development, and we are hopeful to launch this in next few months, is the roster update. So the demographic update is very important. So if there is a birth in the household, or if there's a death in the household, previously we were not updating this information. Because if there is birth in the household, there is extra burden on the household, so they should get the opportunity to become part of the program and update their information. So in the dynamic registry, we are giving the opportunity to the household to record their birth registration, death registration. They can update their marital status. They can update their gender information if they provided wrongly during the door-to-door activity, and they can also update their disability status. So when we will enter a child or will make him part of the registry, we'll collect information on all the variables that I explained in my previous slides. And we'll collect the information of child about gender, bear form. So all these status will be updated with either computerized national identity card or with the help of bear form. So with that, we are not also strengthening our registry, but we're also strengthening the civic registry, the national database registry as well, because we are making compulsory for the household to have the bear form or the CNIC prepared before interacting with our registry. And another criticism that we faced was that our registry was not shock responsive. Like if there is shock happened and if family or household lost their assets, we were not giving the opportunity to that particular household to update their socioeconomic status. But with this dynamic registry approach, now we are allowing the families or the households affected by any shock to update their socioeconomic status. So they will be processed through, again, a fresh survey. They can update their assets information, they can update their demographic information, And this will only be for the household residing in the shock responsive area. So after this, wherever shock will occur, we will open the registry for the update of all the households residing on those particular areas. Next. For those who will not become part of the program, because as we mentioned, to give the benefits to the households, we have to determine a certain PMT score, keeping in view the availability of funds, keeping in view the resources we have. So currently, as I mentioned, we have PMT 32 as the eligibility cutoff to provide the benefits in all programs, whether it's SARS Kafalat or it's a conditional cash transfer program. So we are using the PMT score of 32. So those on the completion of the survey exercise who are over and above the PMT 32, they will also get the opportunity after 2 years to update their socioeconomic status. So it's very difficult to operational this thing on real-time basis, because if we are carrying out the survey of one household today, and if that household is ineligible, they will probably come again and again to update their assets information. So for that, we have to lock a period in which I think we thought that we should restrict those households to not change their assets information. So for those households, we are putting the bar of 2 years, and after 2 years, we will actually call all those households who are not part of the program. They can visit our desk and can update their socioeconomic status. So the demographic information can be changed at any point of time. There is no bar, but in order to change the assets of the households, there is a bar of 2 years that a household will have to follow. And we will then mobilize all the households after 2 years to update their assets information through our desks. Then another criticism was previously that those who become part of the program, they remain in the program for like 10 years, and we haven't done any validation to exclude those, even if they are well off and better with time. So in order to cater that aspect, we are also recertifying our existing beneficiaries, those who are part of the program under the eligibility cutoff. They will be responsible to visit our desks after every 3 years to update their socioeconomic status, and if they will not turn up, we'll stop their benefits. So after every 3 years, we'll give them 6 months to all those who are receiving benefits from the program to update their socioeconomic status, to recertify their socioeconomic status. And once they will done, they will their socioeconomic status will be redetermined, and we'll see whether they are still eligible to receive the benefits from the program or not. So, after 2 years, we will invite the non-eligible households. Like non-eligible household means that those who are above the PMT score, and after 3 years, we will invite the eligible households, those who are receiving the benefits, to update the information. And on completion of the 3rd year, we will take 6 to 8 months to calculate their socioeconomic status, validate their information through third party and NADRA, and we will recalculate their PMT score after 3.5 years. And you can say that in 4 years' time, the registry will automatically be updated in terms of their assets related information. So these are the 6 steps that we are following to make our registry update. So after 4 years, our data will automatically be updated, and we will not require any door-to-door activity for the purpose of recertifying our database. And the information, those who consider themselves eligible or want to participate in the program can participate through type 4 and the type 5. So these are the dynamics of how we are making our registry update. So with that, I'm concluding my presentation. If someone has any specific questions, we can quickly have 1 or 2 questions in order to give more clarity on this.